Let's talk about 4 simple questions that'll help you determine the best treatment methods for your joint pain and help you save money on related healthcare costs over the course of your life. Conditions of the lower back, hips, knees, and ankles affect millions of people. And while the pain can be unbearable, many times it's the mounting bills that can end up hurting just as much. With lower extremity joint pain being so prevalent, there's a staggering amount of treatment options to choose from. The problem? Most provide short-term results that merely mask the pain, which means you have to use them regularly, and that's where costs can really add up. Take knee arthritis, for example. Imagine you're 50 years old and decide that a knee replacement just isn't a procedure you want to take on at the moment. Over the next 5 years, you try weekly physical therapy visits, injections every month or so, a couple of different braces, and some pain medication. At this point, it's very likely that you're spending upward of $1,000 per year to dull your knee pain, depending on your insurance coverage, of course. Meanwhile, being that these treatments mask pain rather than addressing the root cause, your knee arthritis will likely continue to worsen over time. To keep up, this pattern of treatment could easily continue for the rest of your life, costing tens of thousands of dollars and hundreds of hours spent in medical offices, plus the travel costs for each of those visits. But let's say that at age 55, you decide to go under the knife and do surgery. A total knee replacement surgery could cost you thousands of dollars in coinsurance, not to mention the time spent out of work during the recovery phase, co-pays for follow-up doctor visits, pain medications, and braces. Plus, most knee replacement surgeries require months of physical therapy after the surgery in order to work through the continued pain. So if you're one of the millions of people with pain in your lower extremities, make sure you're working with your doctor to map out a treatment plan beyond the immediate future. Ask questions like, is this a long-term or short-term treatment? How often will I need this type of treatment and how many hours will it take per week? What types of costs should I expect over the next 5 years by doing this type of treatment? And should I expect to incur these types of costs for the rest of my life in order to treat my pain? Understanding and planning for the long-term costs associated with joint pain can not only help guide your decisions regarding treatment methods, but it can also save you money over the course of your life.